All right. We're streaming live on YouTube, so I am going to get us started. Thanks for joining us, everyone. Today is Friday, May 1st, and thank you for joining us for another media briefing. We have lots of information to share today. So we have a statement first from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, followed by Regional Chair Karen Redman, and also a statement from our CAO, Mike Murray. So with that, I will pass it over to you, Dr. Wang.
Thank you, Bethany. Thank you, everyone. So, sadly, we continue to see COVID-19 deaths in our community. To date, 72 people have died. I again wish to express my deepest condolences to all the families.
Okay, I believe we're having some
friends and caregivers.
Okay, I think we're having technical trouble with Hsiu-Li. Is everyone hearing that as well?
COVID in our community, 11 long-term care.
Okay, Hsiu-Li, can you hear me?
Yes.
You were just breaking up. Yeah, you're just breaking
right?
up a little bit. Do you want to just back up a minute and try again? If you're still having trouble, we'll move over to Karen and come back to you, okay?
Okay. So I'll try to go from where I was just before. So there are currently 12 long-term care or retirement homes in Outbreak. 316 people have now recovered from COVID in our community, and 11 long-term care or retirement home outbreaks have been declared over. COVID rates broken down by area municipality. You may have noticed that is new on our dashboard this morning. The number of positive cases in each area municipality is skewed based on testing guidance that prioritizes groups and settings at greater risk, including long-term care and retirement homes. Still, it demonstrates that COVID-19 is in all our area municipalities. As we know, there is broad circulation of COVID-19 in our community, and residents should assume that they could get COVID-19 anywhere in the Waterloo region. Thank you to everyone in our community who is doing their part to help us slow the spread. By staying home and limiting the number of trips you make, you are protecting yourself as well as others. Your actions help protect those who cannot stay at home. Your actions help protect healthcare and other essential workers. Your actions help protect vulnerable members of our community, including those in long-term care and retirement home settings. I appreciate that the past few weeks, or several weeks, have been challenging. These public health measures are hard. If we break public health measures now, we can expect cases to rise, and we can expect these measures to continue. Please know that your efforts are truly appreciated. We need to continue to work together, and we cannot do this without you. Thank you very much.
Thanks, Dr. Wang. I'll pass it over to Chair Redman. Go ahead, Karen.
Thanks, Bethany. This past Monday, I had the pleasure of visiting with some staff at Public Health, and I would like to recognize the hard work and dedication of the epidemiologists and the health analytics team, especially in the area of gathering the critical statistics we rely on daily. In addition to all the other important data that they have been generating, they have supplied numbers of COVID-19 cases in each municipality. I'd like to remind everyone that this data reflects the positive cases identified through testing of prioritized groups and settings in Waterloo region, like long-term care and retirement homes. There is a concentration of long-term care, retirement homes, and residential care facilities in certain municipalities. That increases the rate of cases in those communities. This data should not be misinterpreted. to give a false sense of security to those who aren't in one of those settings. As I said before, COVID-19 is still in our community and especially impacting long-term care and retirement homes. New cases due to community spread of the virus are being identified each day, and the risks of contracting the virus are the same throughout the whole of Waterloo Region. Each day, public health staff report on the numbers, but we have to remember that each of those numbers represent a friend or a loved one and a member of our Waterloo Region community. This is why I ask you to continue to practice physical distancing. We've been at this a long time, and I know it's beginning to wear on individuals and families. We can all agree that COVID-19 has changed our lives, and we often find ourselves longing for a time before the pandemic. It is especially challenging for children who may not understand the reasons why they are being kept home and away from their friends and extended family for so long. They are understandably anxious, and they're looking to adults for clues and cues to know when things will return to normal. I'm addressing talking to children about COVID-19 in some of my past videos, but here are a few things that we can do as a parent or a caregiver to ease their stress and uncertainty. Keep familiar routines up as much as possible. Provide facts about what is happening in our community and give clear information in an age-appropriate way. Listen to their concerns, acknowledge their feelings, and provide reassurance. Include them in phone calls and video calls. Explain why physical distancing is an important step to stop the spread of COVID-19. And together find one thing to be thankful for each day. The forecast this weekend and beyond looks promising with sunshine and milder temperatures to come. It's okay to go outside and enjoy the warmer weather, fresh air and sunshine, but please try to stay close to home and in your own neighborhood. Thank you for staying home, for practicing physical distancing as much as possible, and for everyone who is doing their part to keep our community healthy and safe. We're in this together, and we will get through this together. Have a good, safe weekend. Thank you.
Thanks, Karen. I'll pass it over to Mike. Go ahead, Mike.
Great, thanks. So I've got one item that I just want to reinforce this morning, and that is reinforcing some messaging that was sent out today by many of the area municipalities related to fireworks and Victoria Day weekend. So I think media outlets would have got media releases from a number of the area municipalities. And so I just want to reinforce some of the key messages that are consistent right across all the area municipalities. So I'm going to read from one of those releases. To meet physical distancing guidelines, public firework displays will not be permitted, and public events have been canceled across the region for the May long weekend. Fireworks cannot be set off in municipal parks, sports fields, laneways, or on school board property. Additionally, residents are encouraged to exercise caution with private backyard fireworks displays. This is due to provincially imposed limitations on gatherings of more than 5 people, not part of the same household, as well as the possibility of tying up emergency resources if something should go wrong. Residents are asked to keep celebrations small, less than 5 people, immediate family only those in their household, and consider the possibility of celebrating the holiday in different ways this year. And please note that municipal bylaw officers will be out enforcing the current restrictions. So I hope everybody takes that seriously for the May long weekend, which is a couple weekends away, but I think the area municipalities wanted to reinforce that before people rush out and stock up on a lot of home fireworks. Thanks.
Thanks, Mike. All right, so I will pass it over to the media for questions. There are quite a few people joining us today, so just a reminder to keep it to 2 or 3 questions. We'll start with Tim from 570.
Yeah, can you hear me?
We can.
Okay. Yeah, just looking at the hospital outbreaks, it appears that there's one remaining at St. Mary's on the 5th floor. How has staff been handling this outbreak in the current situation?
So the hospitals have been managing this outbreak, and they continue to keep us informed. For the specifics, I think you would need to ask the hospitals, but we're happy to see that 3 of the 4 units that have been declared are now declared over.
Okay, and then with the new with the breakdown of the Tri-Cities and the township, it looks like Kitchener was the hardest hit. Is there any speculation as to why that is?
I think that it's important to note that these are skewed results automatically because of the fact that only prioritized groups and settings are being tested now. So I do not think that these rates represent or are representative of the spread of COVID-19 in our community. I think that limitation to testing has to be taken into account. I think what it does show, though, is that it is, despite the skewed results, it is in all area municipalities, and I think that is the key message for people to be aware of. That people can get it anywhere in Waterloo Region, and there isn't an area municipality that isn't at risk or somehow is safer than another area municipality. Everyone needs to take precautions everywhere.
That's great. Thank you so much.
Thank you.
Okay, thank you, Tim. I will pass it over to Jackie from CBC.
Hi, Jack.
Hi. Okay, I also have a hospital question for you. I did notice that one of the outbreaks was resolved before 2 weeks had passed. And correct me if I'm wrong, I thought that was the threshold, at least for the long-term care setting. So I'm just curious, is it different for hospitals then?
No, it's not that it's different. It's just that the 14 days doesn't necessarily start when the outbreak is declared. It starts when it's the last day, for example, that somebody was in a position where they could have been exposed. So it's a little complex, but basically, when you find a cluster of cases, you investigate, and if you find that it looks like there was likely transmission in a hospital setting, then you declare the outbreak. But it could have been that the last date at which there could have been possible exposure to others was earlier than the date at which they declared the outbreak. So it's really from that date that 14 days is counted.
Okay.
Yeah.
I also noticed that while we see, this is a long-term care question, we have, I just want to make sure I have this right. We have the village at University Gates, and then we also have the village in University Gates being identified. Hold on. No, they're saying it says both here. So is there a new?
I'll pull up the dashboard at the same time so I can follow.
We got this as a typo report from a reader.
Sorry, my connection seems to be a bit unstable. So I'll just I'll try to follow what you're saying on my screen as well. So okay, hitting outbreaks, the village at University Gardens. Yeah, that's what I have.
Sorry, the University Gates. Yeah.
Sorry, University Gates. Yes.
So there was an outbreak. It was resolved. Yes. There was a new outbreak. Is that? Yes. Am I reading this correctly? Yeah.
Yes. So they had a previous outbreak that was resolved, and a new one was declared on the 20th. And yeah, as I mentioned on another briefing earlier this week, that is a result of a strong monitoring system in place that will pick up any new cases, and as long as there's a new staff or a resident case, one or the other, then it puts them back into an outbreak situation. it's just picking up the things that can happen to any home. And so I attribute that actually to a good surveillance system picking it up. And it's not a reflection of that home not doing anything right.
Okay. And yesterday we saw, what was it, 14 new positive or presumptive. Today we're looking at 22. Earlier in the week, I think it was 26, and there was a day of 7. What are you looking for in terms of signs that spread is slowing? Is it more days at that 6? Is it more consistent numbers? Like what are you looking for?
So we're working on an enhancement to our dashboard that will more clearly show, the cases that are associated with facility outbreaks and the cases that are not. Apologies, it's taking a little bit of time. We have a lot of data to crunch. But what we want to see is, over a number of days, and we do a number of days because there can be day-to-day fluctuations, right? But what we want to see is that community spread continue to slow down, and we want to see the situation in long-term cares continue to slow down as well. It doesn't mean we'll have less long-term care outbreaks because we're actively now testing to find them. Like we have greatly enhanced testing protocols now to try and find them. So, eventually we'll be testing at every long-term care home, not immediately. We're going by priority, homes in outbreak going first, for example. But because of that, we are likely to detect more cases, even if they're singular cases, in affecting more long-term care homes. And then the long-term care homes, will continue to have cases. But what we're hoping to see in the weeks ahead is over time, a slowing down of the number of cases in long-term care homes and retirement homes or other congregate settings like that. And that will then tell us that curve that is affecting those types of vulnerable settings, that curve is also slowing down. And when we see that, that's what we want to see. We want to see both community and long-term care homes go on a downward path. But we're not there yet with the long-term care homes, retirement homes.
Is there a sense of which one might happen first? Is there good theory as to what likely does tend to happen first?
Among the homes?
I mean like whether community or homes is expected to happen first.
Yes, community spread is already starting to slow down. Like it's not going up like this anymore. It could go like this, right? Because a peak is not necessarily like a day. It can be spread out over weeks, but it's stabilizing or decreasing. Whereas the long-term care home cases continue to go up.
Okay.
So we're there for long-term care home and retirement homes. We're still on the
Thank you.
climb. Okay.
Okay, is that good for you, Jackie?
Yes, thank you.
Okay, thank you. I will pass it over to Nicole from CTV if you're ready, Nicole.
Yeah, I'm ready. Curious, why have you started to break down the numbers by region, by city?
We were asked for that data, and we have large enough numbers at this point to break it down. But with the important caveats that I mentioned earlier.
Okay. Now, the rate of new cases and deaths at Forest Heights seems to be slowing, but we've heard concerns about a second wave. Will the preventative measures continue to stay in place, like bringing the number of residents per room to 2? And are there additional measures being implemented to prevent a second surge?
Mm-hmm. So talk about a second surge generally refers to a second wave that we'll see in communities, months later. So we're still in the first wave, and our focus is still on the first wave, and on a day-to-day basis, on homes, including Forest Heights. And so measures continue to be taken. For example, as you may be aware, Forest Heights announced earlier this week that it was continuing to transfer residents from the home to area hospitals. And so that transfer has been taking place throughout this week. And I think it will continue. In the days ahead. So that is one of the measures in order to reduce the number that are remaining at the home in order to be able to continue to keep residents further apart. So yeah, so those actions are continuing on a daily basis. And, Forest Heights, Rivera are providing daily updates to public health as well as system partners, the hospitals, the Ministry of Long-Term Care, etc. So yeah, work continues.
I think this question is for Mike Murray or Chair Redman. The city of Burlington is banning drive-by processions and parades involving more than 5 vehicles. What's the region's take on this, and does the region plan on doing the same?
Mike, do you want to answer that?
Yeah, I'll try. And Nicole, good question. So I wasn't aware of what Burlington is up to. I'm not quite sure what their rationale is. So that's something that I think we'll have to look into, and we'll have to talk to public health and our bylaw enforcement people and kind of see what their perspective is on it.
I'll just quickly add, Nicole, there's still a provincial order in effect that restricts public gatherings to no more than 5 people, unless it's 5 people in a household, right? So whatever is happening in the community has to follow those orders. Those are still in effect.
And if I can just add to Nicole, there's a bit of an urban legend out there that the police are randomly stopping people who are driving, not necessarily the situation you're talking about, but just people driving around. And the police are very busy doing the things that they do for the community, and they're not randomly stopping drivers to ask them if they have a destination or if they're out for a family drive.
Thank you for that. And with the nice weather this weekend, what do you guys want to see and not want to see out there? Are there any tips for people who will be out and, enjoying the weather? And could we see more officers and bylaw officers out and about, just sort of monitoring the situation?
So maybe I'll start, and then Chair Redman or Dr. Wang might want to add in. So, I think we've talked before about the monitoring, enforcement, compliance. We've got a combination of public health inspectors, regional bylaw officers, local municipal bylaw officers, and Waterloo Region Police. So they will all be out and about on the weekend. And, the focus has been, as Dr. Wang said, enforcing the provincial orders. So provincial orders are no public gatherings of more than 5 people. So they will be monitoring and enforcing that. The other general guidance over time has been stay home as much as possible. And if you feel you need to go out, stay as close to home as possible. So I think that's what we would hope to see is, people only going out when needed. And if they go out, staying as close to home as possible, avoiding, congregating in large groups, avoiding crowded spaces, those kinds of things. That'll be my perspective.
Okay, that's it. Thank you.
All right, thanks, Nicole. I will pass it over to Joanna if you're ready.
Yes, thank you. A couple questions for Dr. Wang first. The dashboard now has the outbreaks in congregate settings. Can you tell us a bit more about those? Like what sort of settings specifically?
Sure. There are some settings like group homes or other congregate settings where the residents are more vulnerable. For example, they may have significant medical issues such that that's why they're in those settings. So they often are small. So for privacy reasons, we are not breaking down outbreaks in those settings by facility. But that said, you know, providing them in an aggregate form does keep our community informed about the fact that you know, there could be cases in these settings. And so that's the purpose of providing that information. It's just to be a little bit more comprehensive. You know, the long-term care homes and retirement homes are under provincial directives, and they have a lot of requirements in place. And, you know, we're monitoring very closely for those homes. We also not long ago started to put the hospital units that are an outbreak on our dashboard, and now we've added the other homes or small congregate settings where these cases could occur, and where, you know, we are also, as public health and other health system partners as needed, providing support to. So that's the reason for that.
Mm-hmm. And then you covered this a bit, but just wondering, like, do you have concerns about sharing the case number by municipality? Like, are you worried that maybe people might sort of look at it and think, oh, like Kitchener is way worse off than anywhere else?
Yeah, so we've had requests for this data, and you know, most of the health units have been providing this data. You know, it is something that has been requested of us, and, you know, we feel we have sufficient data at this point to be able to break it down into those geographies. I'm not going any lower than that, for example, because they are, you know, they are by default skewed in how they show the distribution of the cases because of the testing priorities. But I would say that, you know, this was yeah, so this is something that, you know, it's part of the broader picture. But I think the key takeaway from this is still to show that we have cases in every municipality, and people should just assume that they could get it anywhere. And there's not a municipality that is at low risk while another municipality is at high risk. Everywhere across Waterloo Region, people could get COVID-19. We know this because of the way it spreads. It spreads broadly, it spreads easily. And so there's no reason to believe that somehow it would be only a higher risk would be only in one area municipality. So, you know, it's to be transparent with the data and to show what we have, but with that understanding that you know, about those caveats, which is important to remember.
Right. Thank you. And this question is probably for Mike Murray. Just talking about the fireworks displays. Are you guys a bit worried that maybe the message will come off kind of wrong and sound like you're like ruining people's fun, especially at a time when people are feeling like very stressed and looking for, you know, something that's enjoyable and sort of normal?
Unmute, Mike.
Thank you. Yeah, so I think it's a really tricky balance to strike. And I think you're right. People are always looking in the midst of, you know, all this uncertainty. People are looking for a sense of normality. I think the reality is we're not in normal times. And so really, when you look at what the area municipalities are reinforcing, I think the message is, part of the message is similar to what it's always been, which is you have to be really, really careful using fireworks. So they've been clear, public displays of fireworks are not happening because they want to avoid, you know, large public gatherings. They've always messaged about the backyard use of fireworks. You know, I know the local fire chiefs are always, every year, concerned about people using fireworks in their backyard. And, you know, it can go wrong pretty quickly. And then that imposes demand on our emergency services, you know, potentially demand on fire, potentially demand on EMS. So that's part of it, is just actually a consistent message about be really careful with backyard fireworks. And then the other message, which has been completely consistent for the last 6 or 8 weeks, which is avoid large public gatherings. So avoid gatherings of more than 5 people, you know, beyond immediate households. So I think those messages are actually pretty consistent. So I hope that they're not misinterpreted. I hope they're taken in the spirit that they're intended, which is basically to keep people safe and to keep our first responders safe and keep them available for, you know, other really important things.
All right, thank you.
Thanks,
Those are my
Joanna.
questions.
Okay, I will pass it on over to Namish. Go ahead if you're ready.
Hey, my question's for Dr. Wang. So I just wanted a clarification. If a person is a staff member at a long-term care home, would they be listed in that long-term care home city, or would they be listed as their home township? So for example, if someone was a staff member at Forest Heights and lived in Wilmot, where would that be listed on the dashboard?
Sorry, it would be listed with the facility.
Okay.
Now, that said, it's not possible for us to be 100% certain that all the staff cases in staff who may reside in other jurisdictions, that we've included them all, just because of the fact that when they live in other jurisdictions, the results of their tests go to other health units. That said, we work closely with Forest Heights to try to capture as many of those staff as possible. So, you know, based on what we understand, both from the information that we get if they live in our region, and also from the information that Forest Heights will give us about the number of staff that they have who have tested positive, we reconcile that information, and that becomes our total. So generally speaking, yes, you know, if a staff person who works at a home tests positive, they will be counted in the staff totals for that facility.
Thanks. And just a follow-up question. Are you noticing any trends in terms of the different cities and the townships? So for example, like I'm seeing here, Woolwich is at 164.7 over 100K, and then Kitchener is obviously pretty high. Is there a reason for that, or is it sort of just what you were saying before, is that it is existent across the whole region?
Yeah, so you may have noticed that we tried to show the portion of that rate which is due to the facility outbreaks. You know, for example, Kitchener has 44% of the long-term care home, retirement home capacity in the region. So it's actually quite expected to see what we see for Kitchener. So yeah, so you could see the sensitivity to those area municipal rates based on where testing occurs. So it's not just the fact that long-term care home and retirement home residents and staff are tested when they're in outbreak, but it's the fact that we test many of them, and eventually we'll be testing all of them. So that's a very, very focused strategy on certain settings and groups only. So at this time, you know, based on what I see, it reflects that very focused testing strategy, and it also shows that we have cases everywhere.
Right, and is there a reason that it was displayed in, like, I guess, rates rather than just posting the amount of numbers? Is there a reason for that?
Yeah, well, it's because you know, that will make it a more realistic representation of what's happening, even though it's skewed by default, because you know, there's more people, for example, in urban settings than there are in rural settings. So if you did it just by case numbers, you would have even more skewed results.
Yeah. All right. Thank you.
Thanks, Namish. Okay, we have 3 more reporters queued up, so I will pass it over to Damon for the next question.
Hello. Today I'm going to start off. I just want to learn some more information about the new outbreak at Elmira, the Chartwell and Elmira TLC.
Okay. What are your questions about that? What I have is what's on the dashboard. Do you have other questions about that?
Yeah, I was wondering if there's any other patients that have, if everyone's been tested and all the precautions that are being made, because I haven't heard anything about that until just now.
Okay, so Chartwell Elmira has one resident case. Okay, and it was yeah. So basically, there it depends on where the case resided in the home
And again,
and what exposure they may have had to other residents and staff to determine which people will be prioritized for testing first. But eventually, all homes in outbreak, it will expand to other areas of the home. I don't know at this point where it's at exactly in terms of how many we've tested, but it will start with the area of the home that we think could be impacted first, and then it will progressively move to the rest of the home. And it's been an outbreak since the 27th, and there still remains one resident case. So that's always good in terms of progress, because we don't want to see more cases if we don't have to. But that said, we could very well see more cases. We'll just have to monitor that. And we do that every day. We monitor that. We communicate with the homes, all of these homes every day.
Okay, and then back to the new cases per 100,000 population. Woolwich has a very large scale, and on the outbreaks, there's only the one location listed. So this would include also like the smaller, more private locations?
Yes.
Okay. Perfect. And then my next question is for Mike Murray. I was just wondering, with construction, which projects are allowed going on? Can anyone start up? And how is that going about with certain regulations?
Yeah, there are, I think, as you know, there's regulations about essential, like what's essential and what's not essential. And it's, lengthy. So I'm not going to go through it all right now. It's on, I think there's links on the region's website, and there's links on the provincial website about which construction projects are considered essential and which are not. What I can tell you is almost all Region of Waterloo projects are considered essential. They're related to municipal roads, water, wastewater, waste management, transit. All those are considered essential services. So all those construction projects are good to go. And a lot of private construction projects also are in that category. But you'd have to check the provincial and the provincial website.
Perfect. That's all my questions for today. Thank you, everyone.
okay, thanks, Damon. I will pass it over to Irene from the Air News.
Thank you. I have no questions, but I do want to thank you for uploading the municipal figures. That's great. Thank you.
Thanks, Irene. Okay, we have last questions from Kevin Nielsen, and I believe there's a follow-up question, but I will pass it to Kevin first.
I just wanted a clarification on something that was said earlier. Resolved cases on the dashboard, do they include the deaths, or is that just the people that have recovered?
I'm sorry. I couldn't hear your full question, Kevin. Could you repeat it, please?
Resolved cases on the dashboard, does that include the deaths, or is that just the people that are recovered?
Oh, it's just people that are recovered. Yeah, if they passed away, they're in the death column.
Okay, that's the only question I have. Thanks.
Okay.
Okay, thank you, Kevin. We have one follow-up question from Jackie, who I believe wants to make a clarification with Dr. Wang. Go ahead, Jackie.
Sure.
This is just the section on the cases per 100,000 by municipality. Is Waterloo Region, that first entry there, that doesn't appear to be the whole number of all cases, right? Or am I reading this wrong? I see.
It should be.
What is Waterloo Region?
Yeah, Waterloo Region is the whole region, but those are rates, right?
Okay.
So
I'm not
rates.
looking
It's
at I'm not looking at whole numbers here. That's why I'm
No.
reading it wrong. Okay,
Yeah.
thank you.
Okay, does that help, Jackie?
Yes, thank you.
Okay, great. All right, I believe that is everyone. Have I missed anyone, or are there any last questions? Okay, going once, twice. I think that's it then. Okay, that's everything for today. We will see you guys again on Monday. Thanks again for joining us, and thanks for helping us share these messages. See you next time.
Thank you very much. Have a good weekend. Mike.